Hello everyone. Today we are going to study veterinary anatomy. So let's discuss firstly what do we mean by anatomy. So what is this term anatomy? So it is a branch of biological science that deals with the form and structure of body and its parts. So what do we really study is in anatomy is the structure of body and the parts which it contains. Next, it has certain types like gross anatomy and regional anatomy. In gross anatomy, we deal with the structures that are visible to our naked eyes. That means those structures which we can see through our naked eyes come under the study of gross anatomy. Now let's consider about regional anatomy. Regional anatomy is also known as topographical anatomy, based on regions of the body and relations with various structures. So it is the definition of regional anatomy. Now there are subtypes of systematic anatomy. Systemic anatomy deals with the study of different systems of animal body. Now what are these systems? Like we have one study of osteology. In osteology we study about bones. In arthrology we study about joints and their accessory structures like ligaments. Next, we have myology, in which we study about muscles. We have angiology, we study about organs of circulation. Then we have neurology, in which we study nervous system. Then we have splanchnology, in which we study visceral organs. Then we have aesthesiology, in which we study sense organs. Now there is a diagram of an ox given in the notes, where you can easily see the skull. This is atlas joint, this is cervical vertebra, this part. Then we have thoracic vertebra, then lumbar, then sacral, then coccygeal. So what is this? This is vertebral column. Now after that we have these ribs. This is scapula bone, this is the shoulder joint, this is humerus bone, this is the elbow joint, this is the radius and ulna, this is carpal joint, this is metacarpal. Then we have flanges. So it is the diagram of an ox. Here you can see the hip region, in which we have ilium, ischium as well as pubis. Then we have this femur bone, which is the longest bone. Then we have stifle joint here between humerus and tibia and fibula. Then we have tarsals, metatarsal and flanges. Now there are three types of joint which we have to study in lower part, that is fetlock joint, pastern joint and coffin joint. Now the fetlock joint is between the metatarsal and phalange 1. This pastern joint is between phalange 2 and phalange 1 and phalange 2. This coffin joint is between phalange 2 and phalange 3. Now there are other terms in anatomy which are very important to study, like those structures which are close to the head region are known as cranial, and those structures which are near to the tail region are known as caudal. Now those structures which are towards the animal or towards the junction of the animal are known as dorsal, and which are towards the ground are known as ventral. Now in the head region only, if certain structures are close to the nose or muzzle, they are known as rostral. Now there are certain things which we have to know about the part of an animal below the metacarpal and tarsal. Carpal and tarsal. So what are these regions called? So the part which lies towards the head is known as dorsal instead of cranial in both the cases, forelimb as well as hind limb. What I am trying to say is that those region which faces towards the head, in case of lower regions, this region and this region, they are known as dorsal ends. And in forelimb, the region which faces towards the tail is known as palmar, and in hind limb which faces towards the tail is known as plantar. Palmar and plantar both together are known as volar. Now there are some planes which we have to study. This plane which is cutting the animal into right and left part is known as medial plane, and the plane which is cutting the animal in cranial and caudal end, this plane is known as transverse plane, and the plane which is cutting the animal in horizontal direction, it is known as horizontal plane. So these were certain terms, and there is another term, proximal and distal. It is used generally for limbs. Proximal end is towards the body and distal end is towards the ground. So these were certain terms which we have to remember. Now another plane I want to discuss here is sagittal plane and median plane. Median plane is this plane which I earlier told, that which cuts the animal into right and left part, and the parallel plane to these median plane which cuts the animal into unequal parts are known as sagittal planes. Now let's read the definitions of these directional terms. So what was dorsal end? Dorsal end was the dorsal structures were those structures which were away from the ground and towards vertebral column. What were ventral structures towards ground? What were cranial parts of body towards head? Caudal parts of body towards tail. Rostral within head, the structure towards nose or muzzle are said to be rostral, as I discussed in the diagram shown to you, because anatomy is a subject in which you have to get knowledge from the diagram. It is not a subject from where you can just mug up. You have to see the diagrams and then you have to remember those diagrams, not definitions. Now we have medial end, structure located towards medial plane. Lateral, structure located away from the medial plane are known as lateral. Like I didn't set this in diagram, but now I will clear it. Now structures which are close to this median plane are known as medial, and the structure which are away from it are known as lateral. Okay, now directional terms for limbs. We have proximal term, like structure that are present towards the junction of body, it is only for limbs. Distal, structure towards the ground. Now there is a note you have to remember, above carpal and tarsal, the structures of towards head are cranial and structure towards are caudal, but below carpal and tarsal the structure towards head are dorsal for both limbs and volar for which part? Volar for both limbs, but in case of forelimb we call this volar part palmar, and for hind limb we call this plantar. For digits, the structure towards central axis are axial and away from central axis are abaxial. Now these were some longitudinal planes which I discussed in the diagram of a dog. In longitudinal planes are planes along the axis. We have median plane and imaginary plane passing through the body so as to divide the body into two identical right and left parts. In sagittal plane, what we studied, it is also known as paramedian plane, which it is any plane which is parallel to the median plane dividing the body into two unequal parts. Then we have transverse plane which divides body into cranial and caudal segments. For limbs it divides them into proximal and distal parts. How? You can easily see from the diagram. Now we have horizontal plane. It is the perpendicular to both median and transverse plane. It divides the body in dorsal and ventral parts. Now this is horizontal line, this is perpendicular line. So this, if we cut an animal in this direction in x-axis, that is known as horizontal plane. Okay, now there are two important diagrams which you can relate to. This is a scapula bone, this is your humerus bone, this is radius and ulna, these are carpal, metacarpal and phalanges. Now the joint between this scapula and humerus is known as shoulder joint, and the joint between this humerus and radius ulna is known as elbow joint, and the joint between radius ulna and carpal are known as carpal joint. And this area or this region of carpal, metacarpal and phalanges together is known as manus in case of forelimb, and tarsal, metatarsal and phalanges in case of hind limb are known as pes region. Okay, now the joint between this bone, and this is the hip bone, and this is femur, the longest bone, is known as hip joint, and the joint between this femur and tibia and fibula is known as stifle joint. Which joint? Stifle joint. Okay, and the joint between this tibia and fibula and tarsal is known as tarsal joint. Now as I discussed some joint like pastern, coffin, and what was the other joint, fetlock. Now you can easily relate with this diagram. This is your tarsal bone, or carpal bone. Now the joint between this, sorry, metacarpal bone and this phalange one, the joint between this metacarpal or metatarsal bone with the phalange one is known as fetlock joint, and the phalange one joint with phalange 2 is known as pastern joint, and the joint between pastern 2 and pastern 3 is known as coffin joint. Okay, now there are some forelimb bones which you have to remember as I discussed in the diagram. So in the shoulder girdle you have the shoulder region which I showed you here. This is the shoulder region. Here there are certain muscles in the shoulder region. There are certain muscles which fix it with the body of the animal, and it is known as synsarcosis. Then we have this humerus bone. This you can relate to, this is the humerus bone. In this humerus bone, it is also, this region is known as arm region. Here you can easily find the shoulder joint also written in the diagram. This is the arm region and this is the shoulder joint here. Now then we have radius and ulna, forearm region, elbow joint. This is the radius and ulna. This is the elbow joint, and what this region is known as? This region is known as forearm region as mentioned here. Now the carpal, metacarpal and phalanges were, as I said, manus region. As I showed you here, this is the manus region, and it is the knee joint between carpal and radius and ulna. This is the knee joint. Carpal joint is also known as knee joint. Now we have certain bones, regions and joints of hind limb. We have hip bone, also known as oscoxy bone. Here we have sarcoilic joint between sacrum and ilium. This is the sacrum or ilium bone. Here they are fusing and they are making a sarcoilic joint. Then we have humerus, arm region, shoulder joint. This you can relate to shoulder joint, sorry, hip joint. This was the hip joint in thigh region. Then we have tibia and fibula in leg region, where it is known as stifle joint, as I mentioned in the diagram. Then we have tarsals, metatarsal, phalanges, pes joint, pes region. Then hock joint between tibia, fibula, tarsal and metatarsal. Now I will again show you this diagram. This is an important diagram. This is the hip joint. This joint is between this hip region and this humerus bone. The joint between this humerus region and this tibia and fibula region is known as stifle joint, and this is known as tarsal joint, and tarsal joint I think is also known as hock joint. Okay, you have to remember this. So this was all about the basics. Now in the upcoming lectures we will deal with the osteology as well as the different kind of bones. So thank you.